Thank you, Mr. Schweikert.
Thank you, Mr. Chairman. All right, let's have some fun with some math and plan design. And Mr. Hemsley, I'm going to direct most of this to you just because you are truly your organization is the biggest player in the space. We've been working on Medicare Part C, most of us know it as Medicare Advantage. In many ways, dollar-wise, it is multiples of the debate of more subsidies on top of subsidies. This is the MedPAC report, and I know we all argue about what it actually says, but for a decade, I have in here, basically it's saying, and I'm sorry, but we've read it a lot, so it's falling apart, that Medicare Advantage is coming in at 120% of fee-for-service. If you go back to 2005, when we actually started Medicare Advantage, it was supposed to come in at least 95% or less. Is there a way, an organization like yours, where you have very robust networks, how do I actually take a look at the externalities? And look, well, we're blessed to have a Bloomberg terminal. So we pulled up, your reports and those things, $9 billion to AARP. We've been trying to calculate what you pay to brokers, externality costs that don't actually provide healthcare service directly to that enrollee. If I came to you and said, let's go back to the original design, Senator Frisk, 2005, where it's a managed care model, but the profitability comes from helping your population be healthier instead of scoring them as sicker, or some of the craziness that goes on in the star ratings and some of the changes that happened during the ACA, where in many ways they screwed up the incentives, and go back to a classic model of actuarially bid your population, build a model with government so we have some risk sharing if there's an externality of individuals who are remarkably expensive, so you maximize the efficiency in your bid. How do we clean it up? Does it require multi-year enrollment so you can invest in the person to help them get healthier, help them with their BMI, whatever it is? How do we make Medicare Advantage work? And this is for the members of the committee. I know you've all read it. Over the next 7 years, Medicare doubles in cost. We go from $1 trillion to $2 trillion. In 6.5 years, the trust fund is gone. The Medicare trust fund is gone in 6.5 years. That should terrify you. Are you, when you realize how much of the Medicare Part A trust fund actually goes to the Medicare Advantage population? Am I just rambling, Mr. Hemsley, or is this something that your actuaries, our economists, we could build a model? Because our CBO says it's like 1.8 trillion in savings over 10 years if we could just realign the incentives.
Well, actually, I applaud your interest in this, and I think it's very consistent with the spirit of others who have talked about really getting to solutions and getting to a better healthcare environment. And the Medicare program is so important. Medicare Advantage is, as you know, a very, very popular 95% approval rating with seniors. It is, seniors are opting for it. We do take issue with the MedPAC report and believe that the cost of Medicare Advantage is actually about 91% of fee-for-service Medicare. But I would be very open, and I'm sure the industry would be open to exploring ways to make Medicare Advantage more effective and more impactful. We already pursue value-based care as the predominant way we approach that, which is a payment for outcome and holding care providers accountable for the quality and the status of those that we entrust to their care. So I would respond generally that we would be very open and constructive. Over the years, we have offered a number of ideas, and we would like to continue to bring those kinds of things forward.
Mr. Chairman, Mr. Hemsley, my crazy request is I am blessed with the Joint Economic Committee to have a couple healthcare economists. Send me a couple of your actuaries. Let's see if our math works, because the scale of spending and what we're up against debt and deficit-wise, because we've turned healthcare into financial engineering. That's most of this discussion here. It's not healthcare. It's who pays, who gets to be subsidized. I'm passionate. I want to revolutionize the actual delivery of healthcare so it's effective, affordable, and accessible. And that means making it about healthcare. So with that, Mr. Chairman, I yield back.
We align to that spirit completely.
Uberize healthcare. Mr. Schweikert. Mr. Davis.
Thank you, Mr. Chairman, and I think all of our witnesses